One of the first patients I saw in my clinic years ago was a nice lady in her 70s. She used to have severe pain in her back and her legs, to the point that she would not cook a meal at her house without pain. She used to enjoy working in her backyard, but she could not do that anymore. And she would wake up frequently most of the nights because of that pain. Throughout the years, she tried many things. She did physical therapy, she used many medications, she even had spine surgery on her lower back, but she continued to have severe pain. At that point, we decided to do a thoracic spinal cord stimulator trial. She tried the spinal cord stimulator for a week. She was amazed by the result. We proceeded with a permanent implant. I remember when I saw her after the implant, she said, this has changed her life completely. She now can do the things she liked to do in her life without pain. Her pain was 80% better. My name is Abdel-Aziz. I'm an interventional pain physician. I am board certified in anesthesia. I completed my anesthesia training at the University of Arkansas for Medical Sciences. And I'm also board certified in pain medicine. I completed my training at the Medical College of Wisconsin. Many people ask me, what is interventional pain medicine? What do you do for patients? In interventional pain medicine, we treat pain when pain is the problem. Pain can be a symptom of something going on in our bodies. For example, when someone has abdominal pain because of an inflamed appendix. Once that appendix is out, then the pain improves. But sometimes the pain itself is the problem. When, for example, someone has arthritis in the joints of the back, the small joints in the back, which we call the facet joints, and that can cause back pain. Same in the neck. Arthritis in the facet joints can cause neck pain. Or when someone has narrowing around one of the nerves that go to the leg or go to the arm, which can cause arm or leg pain. Or when a person has damage in the small nerves in the feet because of diabetes, which can cause pain in the feet. In many of these situations, there is no surgical procedure that can cure the pain. And here comes the place of pain medicine, in which we use minimally invasive interventional procedures to help alleviate the pain. We can categorize most of our pain procedures into three categories. The first category is steroid injections, in which we inject a numbing medication, a local anesthetic, and a steroid, which is an anti-inflammatory medication, into the joint or around the nerve root that is causing the pain to wash out the inflammatory mediators and help improve the pain. The second group, we call them ablation procedure, radiofrequency ablation procedures, in which we place a needle with a tip we can heat with the radiofrequency ablation machine to heat and destroy the small nerves that make us feel that joint. For example, the medial branches, which make us feel the facet joints in the back or the facet joints in the neck. Third group is the neuromodulation or neurostimulation devices, in which we place a small wire in the spine to stimulate the spinal cord or to stimulate the nerves to change the pain signals before they get to the brain, because the actual feeling of pain happens in the brain. So if we can prevent these pain signals from getting to the brain, then we can feel less of that pain. The best way to treat pain is to use a multimodal approach, to use many modalities to help with the pain so that the patient can get the best outcome. For example, if an interventional procedure reduces the pain by 50%, and then physical exercises and therapy can reduce the pain by 20%, and then a good medication can reduce the pain by another 20%, then the overall improvement of the patient is much better.